What's up, guys? This is Dr. Webb here. I'm a board certified orthopedic spine surgeon here in San Antonio, Texas. And in this video, I'm going to talk about what I've learned over the last 2 years into practice. For those that don't know, I just started my 3rd year in private practice here in San Antonio, Texas, and it's been a wild ride and transition over the last 2 years. For those that don't know kind of the process to actually in the stages and steps to get to this point, you have to undergo 4 years of college, 4 years of medical school, 5 years of surgery residency, and then 1 year of fellowship. Once you complete all of that, you take your boards, which are 8 or 9 hour exams that test your knowledge in the field of orthopedic surgery. You take part 1 of your boards after your residency. So we took it after our 5th year of residency. And then you take your oral boards about 2 years into practice. And essentially you go to Chicago and you present your surgeries that you did. They look at your notes, your operative reports, your consents. They ask the patient's questions. They email the patient and like, hey, how was Dr. Webb? Did he do this? Was he nice? Did he treat you properly, or what are your outcomes? How are you doing after his surgery that he performed? And they email all of those patients questions and answers, essentially trying to make sure that you're a competent surgeon. And recently just completed that, passed my oral boards, became board certified. But over the last 2 years, these are a number of different things that I've taken away. I learned a lot over this last 2 years in terms of surgical skills, about managing patients, about managing complications, about the logistical sides, the managerial sides of employees and overhead and insurance and denials and authorizations, and the list kind of goes on. But over the last 2 years, this is kind of what I've taken away. I think the first thing is that stuff is going to happen. Complications are going to happen. You can be the best surgeon in the world, have the most skills, the best surgically advanced surgeon in terms of your skill set, and still have a complication. You can do everything right to the T, from preoperative to intraoperative to postoperative, and the patient still has a complication. That's just in the nature of our business, especially spine surgery, where it's very high risk. There are a lot of different things that can go wrong. Patients can get infections. If you push on the nerve too much, or if you pull on the nerve too much, patient can have a really bad shooting pain down their arm, or the nerve goes to sleep, and then the patient has numbness down their leg or down their arm. Some catastrophic things can happen. Patient can be paralyzed. Patient can have dislodgement or displacement of their screws or hardware, things that you put into their body. Those things could fail. And that's why they call it practicing medicine, because you're treating a patient based off of knowledge that you've gained and also experience, and then you're hoping that that's the best decision and the best treatment plan for that patient. But no patient is the same, and each patient should be individualized in terms of their care. So what works for one patient may not work for that second patient, and that's kind of what I've taken away from this last 2 years. The second thing that I've taken away is that reimbursements are declining rapidly. What surgeons and doctors used to get paid 10 years ago, 5 years ago, especially 20 years ago, certainly not what we're getting paid these days. So what that's doing is it's forcing a lot of physicians to look at alternative ways to supplement their income. And whether this is investing in surgery centers or seeing more patients, hiring ancillary staff, telemedicine visits, and all other sorts of ways to supplement their income, because essentially you have to see more patients to make the same amount of money that you did 5 years ago. And I think it's only going to get worse. But medicine is certainly not the same as it was when I first came into medicine. A lot of things have changed. Medicare reimbursement rates, every single year they're going down, and we have to see a lot more patients to generate the same level of income, which makes it challenging, especially in private practice when expenses are going up. So expenses are going up, reimbursements are going down, employees want more money every year, but your reimbursements are going this way, and the margin that physicians are able to make is actually going lower and lower. So that's what I've taken away for the in terms of reimbursements and also the expenses. You know, every year the rent at these locations that you're renting from goes up. The EMR, your electronic medical records, the people that manage these, you know, they raise the rates every single year. Every single year, insurance companies are lowering your rates and they're giving you worse kind of reimbursements. It's unfair because we're doing these really complex surgeries and we're getting paid about half or a third of what, you know, the surgeons used to do kind of back in the day. So the third thing that I've taken away is that learning never stops. You're always going to learn. Every day I learn something new. I'm trying to read some article or research. You know, I'm looking at surgical videos, trying to increase my surgical skill set. After every surgery, I sit and analyze in terms of what could I have done differently this surgery that I can do better the next surgery. And I have conversations with my staff and with the people that are with me in the OR, like, hey, what about this case could have went better? What can we do next time? And trying to make sure it runs more efficiently and safely. Been out of school training for almost 3 years now and still learning. Still trying to perfect, you know, that surgical skill set. Still trying to make sure that I have the latest medical knowledge and the skills that patients need in order to, you know, get through their conditions properly. And that's what it's been about these last 2 years. But these are the top 3 things that I've taken away. You know, complications are gonna happen. Surgeons, we get them. You have to know how to manage those complications. If a surgeon says, you know,
I don't get complications or I've never had one,
they're either lying or they don't operate enough. The second thing is that, you know, reimbursements are going down and expenses are going up. It makes it challenging for physicians in private practice to kind of make ends meet. When your overhead is $40,000, $50,000, $60,000 a month, I mean, you have to generate a high level of income, collections, professional fees to cover that. And that's, you gotta bring in $60,000 a month before you even take home $1. So if a surgeon, you know, collects $62,000 for everything that he does that month, and his expenses are $60,000, that surgeon is gonna get a check for $2,000. Trust me, it happens. I've seen it. I know a lot of surgeons, sometimes they get a check for $1,500, or they owe money to the practice because they didn't collect enough. They may have collected $55,000, but all of their expenses, their employees, their rents, their overhead, their EMR is over $60,000. So they don't take any money, which is crazy. I didn't realize that. When I was in training, I was like, wow, surgeons make a lot of money. You know, I'm pretty sure they do. I've never heard of a surgeon that, or a physician that owes money each month. They have to write a check to the practice because they were negative, but it happens. And the last thing is education and learning never stops. Medicine is a lifelong educational process. You have to treat it as such, and just keep that in the back of your mind, that mindset that even when you're out in training 10 years from now, 20 years from now, you're still going to be learning and trying to acquire knowledge that can help you best treat patients. This is Dr. Webb. Thank you for watching, and we'll see you next time.